Ready to do this. Hi everyone, I am some new faces, clear faces at our fourth regional track environmental summit that NIHB is hosting in conjunction with our partners at the Centers for Disease Control Prevention and the Agency for Toxic Substances and Disease Registry. That will be back on the agenda from our Senate team. We have a really robust conversation planned today around several environmental topics that are relevant to the presidency period. And to kick us off in a good way, I'd like to invite United to give us
So guys, welcome Jenny Webster Lucas, Council Member for United Nations. We ask questions and will be supported. Welcome to United Nations. Thank you to Nashville for organizing this regional summit on this important topic to Brett Water, NIHB's environmental director, special welcome to other directors, staff, and organizations representing tribal nations from our region. Here in the U.S., we are blessed with the abundance of natural resources, including forests, wetlands, and water. Great rivers. And the nation is committed to preserving, protecting, and managing resources of our reservation and generations. We work to provide services to restore and enhance our environment, protect and educate the visions and priorities of our nation. And while tribes, we seek to make creative, embrace our families, practice our cultural traditions, push harvest and enjoy leisure activities. As tribal leaders, we know that when it comes to federal and state programs, one size fits all does not work for any country. Every tribal nation is unique to provide services in the best. Each of us design our programs and services in a way that best serves our citizens. Tribal sovereignty, self-governance of our lands, resources, is essential to ensure and help our tribal communities and our closely. We are honored to appreciate your help. Thank you.
Thank you so much. Good morning, everyone. And how's everybody feeling this morning? I want to say I'm just looking upward as well. I'm Dr. Sharon, and I actually wear a hat that serves as director of the Office of Priority Projects, Innovation and Environmental Justice at CDC, National Center for Environmental Justice. I also serve as the interim director of the Department of Health Services. New office of environmental justice, and I have been here today. Just recently, we were fortunate enough to receive a new director. We had to say goodbye to our old director. I don't know if you remember, Dr. Patrick Pricey. And Patrick actually retired this past December. And we have a new CH director on board. And he is here to welcome today by video to be scheduled precluded of actually being here via the virtual podium. But before we hear from Dr. Ari Bernstein, let me, of course, read his bio. All right, Dr. Ari Bernstein, MPH, new director of the National Agency for Toxic Substances. He serves as, or he led the Center for Climate Health Global Environment at Harvard H. James School of Health, and practiced pediatrics at the Boston Children's Hospital. Dr. Bernstein is an internationally known leader in children's health, having spent his career working to ensure that all children have environments that enable them to live up to their potential. His scholarship has explored a broad range of subjects, from toxic exposures to mercury and air pollution to global environmental changes such as climate change and loss of biodiversity and their effects on health. Dr. Bernstein has held many leadership and advisory positions. He has served on the steering committee for the National Academy of Medicine's Action Collaborative on decarbonizing the U.S. healthcare sector. He chaired the American Academy of Pediatrics Council on Environmental Health. He was an advisor to the Dalio Center for Environmental Justice, and he was a member of the board of scientific counselors to our very own National Environment and ATSD. After receiving his degree in biology from Stanford University, he received graduate certificates in medicine and health, University of Chicago, and Harvard University respectively. He is a recipient of the Stanford University's Firestone Medal for Research and a Harvard University Zuckerman Scholarship. I believe we're ready to hear from Thank you, Dr. Bernstein. Well, good morning again. I am just so happy that we're able to actually host these environmental health summits. I believe what we're doing, particularly at NCHTCR and then Landlord Environment, as well as partnering with National Living Board in terms of bringing forward these summits are so important. I think we'll start today by getting to know one another. If you'll just check your agenda. We are now about to sort of do a day one overview. And we will actually go down the agenda as planned. Everybody, I believe, is on board that are scheduled. Everybody is scheduled to present today. But before we get started with day one, I thought we'd just kind of go around the room, introduce ourselves, tell a little bit about the back, we'll just kind of break the ice, get our blood flowing, and start the day. What do you guys think? Yes, you say I have no choice. You say so. Okay. All right. Well, again, you heard from me. I'm Shirley Buchanan, and the also projects and innovation at CPR, and I'm director of environmental justice at HHS. I'm going to start one by saying my fun facts, and then I'm going to turn it over to my colleagues, starting with folks at NCHTCR, and then also as NIH. Oh, okay, got it as well. So let me tell you my fun fact today. Actually, and it really sort of lines up with this whole concept of making sure that we are moving forward with environmental justice. I always say that environmental justice and health equity are certainly linked. As we think about, providing justice, making sure that our environment is just for all, the bottom line is it's all about health, right? I mean, we really want to be healthy, a pristine environment that's linked to that health-based equity issue. We all want to live long, prosperous lives and healthy lives, and for our descendants and our offsprings and our offsprings and offsprings to be there as well. So my fun fact today is that I am a new grandmother. Again, as I think about my granddaughter, and what I want to leave for her and her children, et cetera, this is my first. So excited. But the fun fact is that my daughter is 5'9". She's pretty tall. And my new son-in-law is actually 6'9". Can you imagine? So my granddaughter is going to be very, very tall. Well, in my estimation, very tall. And as I think about, again, leaving this environment for her, this place, etc., I think it's so apropos, if you will, that we are really in this space of making sure that our environment is pristine and just right. So that's my fun fact. I have now a 22-inch, is it 5-week-old? So now I'll turn it over to Valerie at NCHTCR. We have a walking mic.
I have not here, so can I
Okay,
I just want to. Can I walk the mic around? So that means I can choose to go like this.
all right.
Sorry, I just wanted to make sure that she was. Okay. Hi, my name is Rachel Schultmeyer. I work at NCH, ATSBR, and the Office of Private Project Information and Environmental Justice Switch. And one. So I don't know if this is really fun, but my sister actually lives in Wisconsin. They live in Milwaukee with my two nieces, and I was so excited to go to Wisconsin. Oh, I get to see them, but unfortunately they are in Goblin right now. So I don't actually we don't miss each other. But yeah.
Hello, my name is Lakeisha Hawkins. I'm an environmental specialist with the Job Foundation in Oklahoma. I manage our EPA assessment grants. My fun fact is probably not that fun. I had about 24 days of turbo degree heat, so the fun part is coming here and it's like 77. So thank you.
Good morning, everybody. Darren Prescott. I'm an enrolled citizen of Lower Sioux Indian Community in Southwest Minnesota. I'm currently the director of the Office of American Indian Health for the Minnesota Department. I've been there about 3 months and I'm on your panel. So if I don't have an answer, I'll find it for you. Being good there. But prior to that, I worked for the tribe as clinic CEO for 9.5 years. So fun fact, she took the weather one. It's very last December, nephews and niece to Australia just for a fun trip. My nephew liked it so much, he was going to schools there. And it's kind of far away, so I'm regretting it, but yeah, more opportunity. He's 21.
Hi, good morning, everybody. I am Montreal Pavel, just after Chicago. So our region includes the 6 Midwestern states, and most often we work at contaminated sites, so Superfund, national priority list sites, and we do emergency response. And I've been really hoping to do more work, especially in the area of health education with tribal communities. We have urban tribal centers in Chicago and in Milwaukee that I've been doing some outreach, and it's looking forward to getting away from contaminated sites and more productive health education related to air quality, lead poisoning, fish advisories, anything that folks might need a little support on. Maybe. And I don't know if I have really a fun fact. I'm kind of in mode right now, but the joke around our family is we're all from Chicago, but my husband's from Green Bay, and my brother here lives in Paradise. We like to kid about feel over spouses. They're working out pretty well, really, nice kids and everything. So nice to be in.
Good morning, yeah, my name is Marsha Reyes. I'm from Arizona, and I'm in Tribe. And I'm actually here learning about things that I didn't know about in agriculture. I was all the way around. It affects everyone. It's very enlightening, and appreciate I guess things happening in their area that somewhat similar but not quite as well. So it's interesting. The stories about different environmental injustices, health disparities, all of that stuff. It's really eye-opening for me. And I currently serve as for my community, the vice president. So I also work for a nonprofit organization called Change. I'm a director of meetings.
Name Lenapu, Sound Malusis. I am Tina Davis. I am a tribal citizen of North Fork Rancheria, Mono Indians of California. But I work for the U.S. Environmental Protection Agency office as a tribal liaison for Wisconsin, as well as the regional people's advisory. And a fun fact. So, depending on if you're a negative thinking person or a positive thinking person, I grew up in the Central Valley of California. So whenever I do like this, and I say, "Or does the state pack right in the armpit?" But I also got to grow up in the shadow of Yosemite because of that. So that is my tribe's ancestral homelands, and I got to get married on the Merced River in Yosemite Valley, permit free, because we're exercising our use of traditional homelands. So fun. Yeah.
Hi everyone, my name is Leanne Christensen. I'm the meetings coordinator for NIHB. So I'm going to be the one with our lovely AE things here, making sure we get everything correct and going running smoothly. So, I know, but I don't remember one. I've forgotten everything that's fun about me. I really like music, and so I think this summer I've been to about 4 or 5 different concerts so far. Yeah, so I really need to stop spending money on that. I saw you over here.
Hi, everybody. I'm Araceli Cruz. I'm a webmaster for NHB. So if you see me creatively, just like take because it's kind of our social media. Too. And a fun fact about me. I set myself up for failure. I like to cook, and so I taught my nephew how to cook, and now whenever
I love to eat.
I suspect you'll have a kid, but
Oh, I don't know. That's
you will though.
I'm Shirley Irvin, officer, great services at CC. And we always went now and lots of fun. Hello, everybody. My name is Carla Harper, and I am Deputy Director of Domestic Grant Services, Office of Grant Services. I guess COVID and lots of changes. Changes that cause changes. So that we do things that but during COVID, because of all many things, expectations, and we need to take my husband. It's awesome. So I learned how to do my daughter's hair. She's a little bit great to twist and all kinds of things. So now she's 23. I cannot get her to go to beauty salon. She's not. So I learned that I'm very handy and I can do this. See something that's undone.
Morning, everybody. My name is Paul. The chief of the presentation at CC, and I live in Minnesota. So I worked in Minnesota. We lived in Minnesota for memories in the front. More I talk, the more you realize it. I actually grew up in Jamaica, and I moved to Minnesota. Yeah, right before one of the worst winters in a long period. It was 1991, and that was the year of the famous tall blizzard. And that was my first experience with snow, and it came down like for a day and a half, 30-something inches of snow. So as I met people, as I kind of settled in with some people, they were speaking. Where are you from? Jamaica. Why did you come up here? I was an international student. So that's why I came. It would look kind of unimpressed. So just about a few days after I got here, Jamaica bus I come to Minnesota as an attraction. So after that, I thought, when people ask me where you're from, I would say, I'm from Jamaica. So why are you here? I would say, I'm here to train for the winter. And people were really lighted up, and they'd say, yeah, what are you training for? Figure skate. And then the game was over. They didn't believe me.
Imagine that transition, Jamaica to 30 inches of snow.
Yate questions. With the water flow together. My father's line is a tower house. Maternal grandparents are the Reed people, and my maternal grandparents are the Red Bottom people. But I work for a company called Western Sky Community Care, or based out of Mexico. We do managed care work in the state of New Mexico. Part of a larger parent company called Cinti Corporation. We do Medicaid, Medicare marketplace throughout the country. I think the statistics say that 1 in every 15 person is somehow affiliated with Cinti Corporation in the nation. So it's going to be fun fact about me, I don't know if it's fun, I guess depending on how you guys feel, but I'm a huge Dallas Cowboys fan. Thank you. So yesterday I was over at Lambeau Field and did a recording of 2014 Des Bryant catch. Stated my case that it was a catch. If you know football, you know what I'm talking about. But I got rave reviews from it online. I thought it was pretty hilarious. But thank you for having me, National Youth Health Board. Appreciate your support and just really learning a lot more about environmental justice. I was at the Phoenix event a couple of weeks ago, and the video they showed there of the Navajo Plant Lumber Yard really hit deep for me because I grew up in that community. So I'm here again. I'm looking forward to the next couple of days. Appreciate it. Thank you.
Both are on Dallas, Texas area. She's from Texas. My daughter actually lived one grandbaby in Texas, so yeah, we are having.
So I'm Joanna Odenkirch, and I'm the acting deputy director for the Office of Tribal Affairs and Strategic Alliances at CPC. And I've been in that role for about 5 months now. We're hoping that by the end of the year, we will have some permanent leadership within OTASA. Fun fact about me, it's fun or not. I had hip surgery, complete hip replacement about 6 months ago. Main reason is because I've got 3 grandkids under the age of 4 and another one coming, and I want to be able to spend some time running around with that. So that is a priority for me in my future life once I retire.
Yeah.
Hi, my name is Ryan Wheeler, I'm a senior medical specialist at the Amendment District Office with the Service. Been with them since November. Been a really good experience so far. Prior to that, I was working at Iroquois County. There. Fun fact, I have 2 little ones at home. One's 10 months today, and the other's 2 months. And I had actually had knee surgery, so I could keep up with it. Hello everyone, my name is Barry Hugo. I'm the District Environmental Health Specialist at Bryan Ender District Office. A couple of months here. I've been working there for 10 years now, 10 or 11. Prior to that, I was for the U.S. Army and then local health departments. Fun fact about me is I play drums, I play piano, I play guitar, and this year, hopefully, I'm going to release my first album. Enjoy.
Hi everyone, I'm Laurel Vernon. I work out of it in a national program, but I sit in the shop with this protector. Get into all kinds of trouble together. So you'll hear about that this morning. So I primarily work in environmental justice, rural communities, because they have a disproportionate contamination. I started my work out after a couple jobs at college. I worked with Greenpeace. I am truly a tree. Greenpeace hires scientists that keeps trouble. I used to when I was there, and 30 years ago I was in this doing environmental on pulp and paper pollution. So stop launching landfill site, which I believe is a 2%. So my mother said she was prepared to pay. So it's actually a fun fact. I've spent a lot of years working with Great hub. I worked with a lot of tribal nations in my past and graduate school and inherited a great place project and now I'm here again. So life goes full circle. I do have a presentation with features at home, but so you'll get to see it again. But also have our group is very concerned about all tribal regions and all the market justice communities. Contact is good children, teenage from age 15. So do that. So almost one jumps behind the bar at parties or starts obsessively picking up plates.
There. I was in the middle of our case. I'm trying to learn about water systems that are kind of a pumps and pipes fixing guy. You know, I spent most of my career working with water engineers and folks just to make sure that you know, we got those water systems up and running and we get safe water. Let's see. The fact is that you know my goal is to become a professional disc golfer. Disc golf is a lot like regular golf. You play with a ball and a club, these frisbees and baskets. You know, I've been doing it for 12 years. I'm good enough to where I can really beat my buddies on Saturday when I get into tournaments. I just figure I actually got my space. And I asked this other guy who's one that said, "Boss, you know, how do I be a better disc golfer?" I said, "Well, what do you do in the morning?" I said, "I go to work." So that's your problem. if you want to be a real pro, you have to put that at the top and start practicing disc golf. It's actually pretty easy because I don't make any money doing this stuff. So. But I still have that. Yeah. Next time I'm happy.
Hi, I'm Claudia Brown, the health scientist at the CDC Health Program. I'll actually be presenting on the program and what we do in tribes and states and cities today from the last session, so stay awake. Little fun fact, I grew up in North Georgia and my dad was actually an archaeologist. So I spent every weekend going out with him to the archaeology site, have people come, students from University of Georgia, different places, you know, sift the soil, go through various pottery pieces, map out post where houses were. He was very passionate about preserving Native American history and worked on laws in the state of Georgia to protect Native American burial sites. So something, you know, I feel, you know, passionate about, and unfortunately we don't have any tribes in Georgia anymore, though obviously we're on tribal lands. So honored to be here, looking forward to learning more from you all.
Hello, Audrey Dowling, of analyst, the Centers for Disease Control Prevention in the National Center for Environmental Health and the Agency for Health Substance and Disease Registry. I work along with Dr. Green and Dr. working on environmental justice and tribal issues. My fun fact is I am a veteran of the United States Navy, and I was in the Antarctic Development Squadron. So yes, half of our squadron went to Antarctica, half went to New Zealand. I got the training for Antarctica. I went to New Zealand, spent 6 months in either Antarctica and New Zealand. So that's my thought.
Hi, everyone. Good to see you all. I talked earlier that I'm with Gulf Coast Agency Director. I have been to neither Antarctica nor New Zealand, but every place. Bumping the impact not once, not twice.
Okay, no.
I have two. Okay, since I said I was gonna go last, I guess I'm gonna probably get it. My name is Donata Green, and I am the Associate Director for Policy at the National Center for Environmental Health and Agency for Toxic Substances Registry. Let me see, and my fun fact is we're gonna stick in the same vein as my cousin Beck, who was talking about the Dallas Cowboys. About the Warriors. When I was in junior college in Tyler, Texas, I was a member of internationally famous drill team. And we did develop cowboy halftime shows when the Dallas Cowboys went to play. Now I'm really getting ready to tell my age because the stadium doesn't exist. But if you know anything about dance teams, drill teams, it's always the tallest person in the middle, and then it goes down on each side of you. I was the tallest person, so I stood on the 50-yard line, and I performed on the 50-yard line in Texas Stadium. Just my age. So that is my fun fact.
Sounds good, sounds good. Well, really excited about what we're going to hear about today. And really appreciate all of you introducing yourselves and giving you. So, thanks. All right, we'll get started.
I'm gonna turn this one off. Stand up. The other fun fact is my eyes will get here full on Saturday, so I'm relying on these. Okay, so we're ready for the fun now. So we have our first presenter. And our first session, our first presentation will be on CDC's Tribal Public Health Data Site. And this will be an overview of the Centers for Disease Control and Prevention's new Tribal Public Health Data Site, which is designed to assist tribal partners and others with information and tools related to tribal data. The site provides guidance on assessing CDC tribal data, information on tribal data issues, tools, technical assistance, and training, and tribal data related resources for public. So our presenter today is Ms. Joanne Bodick, and she is the acting deputy director for the Office of Tribal Affairs and Strategic Alliances, otherwise OTSA, in our world of acronyms at CDC. Joanne has 40 years of public health experience. Joanne has served as a technical monitor for their tribal partner funding and other special projects for OTSA leadership. She started her public health career at CDC, working in the state local health department STD program in Atlanta, Georgia, and in Maryland. Joanne has an MPH from the Johns Hopkins University Bloomberg School of Health. So at this time, Joanne.
Okay, it's like, just for you all to know, I'm actually a Welsh, so it's up there. I'm Joanne, but it's the same presentation. I'm happy to be here today. I want to take a few minutes to talk to you about the CDC. There's been some changes over the last about 9 months. So I just wanted to kind of give you an idea of where we sit and what our office is responsible for. So if, as you see, the star, it says new center, it's the National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce. A lot of words, we go by FIT, PHIC. This center consists of 2 centers that were previously independent, the National Center for State, Tribal, Local Support, and the Center for Surveillance, Epidemiology, and Laboratory Support. So CSL and our other center combined. Part of the reason why is that we realized because of COVID that there were some activities that needed to be improved. We also realized the things that needed to be moved to a higher level.
So you'll see in the slide that there's an Office of Public Health, Data Surveillance and Technology. That office within CDC is responsible to make sure that our data modernization occurs across CDC. We are working very closely with them on tribal data modernization as well. Next slide, please. So the CDC's new Public Health Infrastructure Center is committed to ensure that every community enjoys the benefits and protection of public health services. So really what that means is not only state and local health departments, but really tribal health departments, tribal serving organizations, tribal epicenters. We are committed to work with tribes and tribal organizations to make sure that they have access to and are supported appropriately across CDC. Next slide, please. So this is the fix office, the center. Dr. Liz Dolphin is our director. She was a previous director for C-Cells. You will see in the square box that Shay Welch is our acting director. She will be the acting director for another 2 weeks. And then we'll get another acting director in until we get a permanent director sometime hopefully by the end of this year. Next slide, please. So the Office of Tribal Affairs and Strategic Alliances, or TASA, if you're not familiar with, serves as CDC's primary liaison to tribes and tribal serving organizations and the conduit for tribal engagement. That means anything related to tribes, anytime a tribe wants anything, anytime that a center would like to do something with tribes, should really come through CDC or at least let us know what's going on. We are the office that responds to the letters that come from tribal leaders. We are also the office that is responsible for tribal consultation, which is required to uphold tribal sovereignty. And we are the office that also works with the CIOs to make sure they understand what tribes are responsible for and what we're responsible for tribes, let's say it that way. We're a resource specifically designed to serve tribes and tribal populations and tribal partners. We are the central point for contact to tribes and tech data questions. And if you have any questions about that, you can contact tribal support at cdc.gov. We are also responsible, in addition to just data, we're responsible for CDC and TSDR's Tribal Advisory Committee meeting. Will be held here in 2 weeks at Oneida Nation. We're very looking forward to having this meeting here. We're also responsible to represent CDC at the Secretary's Advisory Committee meetings. So we spend a lot of time working across CDC to make sure that information is provided to the HHS Secretary's Advisory Committee meeting, Tribal Advisory Committee as well. We do participate in all regional consultations. We are the office that is responsible for tribal consultation. So if for any reason a tribe would like to meet with CDC, contact our tribal support at cdc.gov, and we are willing to consider and set up a meeting for tribal consultation. We also work with all of our centers, make sure that all CDC employees understand what tribes are eligible for, which means that we are that we make sure that everybody recognizes tribal sovereignty, what that means, and that tribes are different, and tribes are the only special population in the United States that is protected by the Constitution, treaties, and laws. It's really important that we all understand that, and make sure that our CDC employees understand that as well. We spend a lot of time doing technical assistance and SME work with our CIOs to make sure that we are supporting tribes appropriately. We also work with some of our centers on such things like recently the Advisory Committee for Immunization came out with a recommendation specifically for tribal members for RSV vaccine, that the second dose be given to American and Alaska Native children for the second season for RSV, ages 8 to 18 or 24 months. We did not have time for tribal consultation, so we sent out rapid input from tribes. We do those types of activities as well to make sure that tribes have an opportunity to provide input on things that may impact tribes. That is important for all of us to recognize. CDC and OTASA recognizes that specifically. Any activity that CDC does, we want to make sure that tribes have an opportunity to provide input if it's going to affect them. We also work, as I said, what this presentation is about tribal data. Making sure that tribes and tribal epicenters have access to data because they are public health authorities. Next slide, please. So just real quick, data sharing with tribes, it's essential. It's a matter of public health and tribal sovereignty. It's really also important because a lot of our data sets, you really need to dig into them to find out American and Alaska Native populations. And it's really important that that data is accessible, timely, and the quality of data is good. We have decentralized public health systems within CDC. And because of that, there's also a lot of laws and policies, data sharing agreements that we need to really consider when data is shared overall, but especially we need to make it easier for tribes and tribal serving organizations and tribal epicenters to kind of work through all those policies and those agreements to make sure that they get the data that they're entitled to. So each data system is unique. And in terms of data ownership, the laws and policy sharing agreements and content, we are working very hard with our tribal epicenters, our tribes, and with our centers within CDC that own that data or have access to that data to make sure the data is shared. Next slide, please. So I want to quickly kind of go over our tribal public health data website and demo. Next slide, please. So just for information that people are not aware of what happened, in March of 2020, GAO released a report saying that texts are tribal epicenters. And so we were told that we need to start working about how we're going to make that happen, allow access quickly and easily to tribes and tribal epicenters. In October 2022, HHS conducted both consultation and concur with urban Indian organizations about how to implement this activity. And then in late December of 2022, we launched CDC's tribal data website. Next slide, please. So this is what the tribal public health data request form looks like. It's pretty easy to fill out. But we have heard from tribes and tribal epicenters that there are better ways to do this. So we are working, we have a temporary assignee level epidemiologist who's taking the lead on tribal public health data access and trying to figure out better ways in which tribes or tribal epicenters can access the data, but also find out ways in which the CIOs can work with us and work with the tribes so that it doesn't take 3 or 6 months to get data sets, because right now that is what is happening. Next slide, please. So website tour demo, do we have that available? Yeah, okay. Well, so let me talk just another minute or two about what else is going on with the CDC with tribal data. We have, as I said before, within the Office of the Director, there is an Office of Public Health Data Surveillance and Technology. They are the lead for data modernization. Within that office, we have a PhD. We've got a gentleman who's responsible for data modernization. We also have somebody within our center, Delight Satter, some of you may or may not know. She is working on tribal data modernization as well. They're looking at ways in which we can make sure that not only that tribes get data or tribal epicenters get data, but also things like data use agreements, making sure that it doesn't take 6 or 8 months. Also, HHS is coming out with the data policy, and she and Jim are both working on that as well to make sure that CDC concerns and tribal concerns are being addressed. So just real quick, I'm going to go through when you click on the website, you can access CDC public health data sets. So the guidance is there. The CDC public health data sets are there. If you click on that one, please, the one above that one. It's like that one right there, yeah. So there are a whole bunch of data sets within CDC. And it's really confusing as far as where you can get the data and how you can get the data. If you could just scroll down a little bit, this is, and obviously, you know, for somebody who's not familiar with this, you kind of go and just looking for data on organizations or whatever, and where you find it is not necessarily the easiest way to do that. So we are also working on ways in which we could revise this website. But in the meantime, if you have any questions, you can contact tribal support at cdc.gov, and we are happy to guide you through that. As I said, we have somebody with an OTASA that's dedicated to that activity, and she can not only reach out to you, but she can also set up meetings with you and the CIO that we think is responsible for this. And again, you don't have to scroll through all of it, right? On page 5, and we're only the part of the way down. We have a lot of data sets for this agency. We are also working at maybe looking at standardizing how data is collected. You know, making sure that we have some common data elements. This is a long-term activity, obviously, but these are some of the things that the data modernization initiative is actually working on. So if you can go back, I want to appreciate it. Just real quick, I want to go through the tribal public health data request form. I've already shown you, seen that. So if you scroll further down, there are some publications, and then there's some technical assistance. The CDC Data Modernization Initiative give you information about what's going on there. CDC disaster epidemiology may be interested some of you as well. I'll talk a little bit for just a minute about CDC EpiAids. If there is a need for an epidemiologist or somebody to help you do data analysis, there is a possibility of CDC be able to send people out or do it virtually, so that is an option as well. We do have a public health law program, and they can do things like work with you if they don't already have it done on what the state laws are for things like data access and everything else. If you could just go down a little bit more. The Council for State and Territorial Epidemiologists Tribal Epicenter or Tribal Subcommittee. There's a subcommittee of all the state and local epidemiologists, and actually they have a subcommittee that works on tribal related activities. We do have representation at that with that subcommittee. But if you have any questions or concerns about that, please contact Thompson and we can help address that. We have heard at NIHP that both there are some of our other national partners that don't understand what tribal sovereignty is and what access to data is. So we are working with some of our other national partners to make sure they understand what that is. Part of it is just the way maybe the grants were awarded to them, but we are working to provide training and other resources to them as well to make sure they understand what their responsibilities are if they're working on providing data to tribes or tribal epicenters. NCUI is also the National Council of Urban Indian Health. We work with them closely as well on issues related to urban Indian populations. We know about 76–78% of American Indian Alaska Natives live in urban areas. So this is a very important population that we work with as well. And then Native Data Online is a free resource that is that was developed to support by CDC, out of the Northwest Portland Area Health Board. And then there's some other things as well. And obviously the tribal epicenters, if you guys don't work with them, you should probably reach out to them. They are funded to provide support to tribes in the areas in which they are represented. They represent the 12 IHS regions, so they are responsible to provide some support. They're funded to do that. If you could scroll down a little bit more, please, and I'm just about done. And then the U.S. core data and accountability standardized set of data as well. Just to the bottom real quick, we do have training available. Lots of training, and if you don't find what you're looking for, please reach out to OTASA. We are happy to do that and provide you resources or link you up with somebody who can provide that training as well. Next slide, please. Thank you so much for showing this website. So that is it. Again, if you have any questions or concerns, you can reach out to tribal support at cdc.gov. And
I think we have maybe a few more minutes. If anybody has any questions or anything, I'm happy to answer them. Now, I am going to be here tomorrow afternoon, and I welcome the opportunity to have future discussions. Well, if you have any questions, not only about tribal data access, but also about CDC and our support of tribal serving organizations, urban Indian organizations, tribal epicenters, or anything related to tribes. Thank you so much.
Hello, everyone. I'm not on the agenda. But my name is Rochelle Rupert, and I am the Tribal Health Project Data Director at National Indian Health Board. And this is perfect because what Joanne was just speaking about, many of the issues, the GAO report, tribal access to data is exactly what we will be talking about at the end of September at the National Indian Health Board Tribal Health Data. It is in person in Washington, D.C. At American University. We are not doing a virtual component because we do want to have robust conversations about this topic, but we will, after the fact, post the presentations, and we need to create videos of it. So I know we've gotten next slide. So just to give you a little idea, we have kind of three main topics, and among these there's going to be many different conversations, obviously, but we're really centered on talking about how to measure health equity and what are the best ways to do that, but also considering tribal sovereignty, trying to really make it strength focused. A lot of times when we talk about health equity and we compare American Indians, Alaska Natives to the white population, and then we tell all the bad news about how our statistics are worse than, and that maybe that's needed sometimes, but we're really trying to move away from that and have a more strengths focus. So we have a couple of conversations about that. We will also spend some time talking about what we learned from COVID, what were some of the ways in which we were able to present data in that way. We do want to talk about promising practices and improving how we collect data about race and ethnicity. That is a topic of conversation in the OFB right now, the Office of Management and Budget. And so while they have already kind of concluded their period in which they're asking for feedback, we have been asked by the Blue Cross Blue Shield Association in particular to still kind of figure out what might be some of the best ways to collect data for health purposes. And so we will have roundtables around that, and we do have a person here from the Shield who's Ms. Charter. She's the Executive Director of Data Strategy, to speak about that. For those of you who know, I'll name drop a little bit. There's Warren coming. I think some people in Indian country know who he is, and Abigail Pentelhoff, Myra Parker. It's going to be a great presentation. Then the third thing is we're going to talk about the challenges and opportunities in tribal access today. Some of the things that Joanne was just talking about, concerns about that it's too difficult for tribal organizations to get the data that they are allowed to have. That's been what the GAO reports. Next slide, please. So there is no cost to register. Obviously, there's a cost to travel. For tribal representatives, we should be sending out tomorrow a blast email from NAHB that does offer an opportunity for participants to get funding from the CDC. And so that should be coming out tomorrow if you're interested. I'll be here also all day, so you're welcome to ask me any questions. Again, it is in person, Monday the 25th and Tuesday the 26th of September. We do have a packed agenda. It's 9 to 5 each day. Lunch will be provided. There's a QR code there if you want to register. We just ask if people register and or decide they're not coming to take themselves off the list because we set with a capacity of 160 and we don't want to turn someone away and then have an empty room because people registered. Next slide, please. So we also, just to let you know, I have our agenda full in terms of speakers already, but we are getting an opportunity for people to present at a poster session, and that topic we were a little more broad on, but obviously something about tribal health equity and data, but we are accepting applications for that through September 1st. Again, a QR code to get to that, or I can tell you an easy way to look at these things. Don't have your phone with you, but we are hoping to have a nice poster presentation on the afternoon of Monday. I believe it's like 3 p.m. For about 30 to 45 minutes. So that would give an opportunity for people to and present some information. And we do just ask that one person be in person to stand up. And that's it. If you wanted to look up and you didn't have a way, you can write down really quickly NIHB.org/health equity, and there's a hyphen between the word NIHB.org/health equity, and that takes you to all of these QR codes that I just had up there. A way to register for the symposium, a way to submit posters. We're very excited, and thank you very much. Thanks for taking us to be on the agenda.
Thanks so much. I think we're up next on the agenda. It's a short break, so we'll be here we're back at 10:30. If you have questions for Michelle or Joanne, folks,